Thank you so much, ladies and gentlemen, for joining me today on this very important presentation. The topic for today's presentation is medical ethics. In today's lecture, we are going to explore the concept of medical ethics, the components of medical ethics, and what is the importance of the individual components of medical ethics and how one can implement them in their clinical practice in order to better serve the ailing humanity. My name is Dr. Aurangzeb. I am cardiologist working at Sedu Teaching Hospital in Swat. Let's proceed to our lecture. What is medical ethics? Medical professionals frequently find themselves facing moral questions and ethical dilemmas in their line of work. Medical ethics provide a framework to help them make judgment calls which are morally sound and right for the patient in question. It's essential for aspiring doctors to have a good moral compass and a solid grasp of medical ethics so they can consistently do what is best for their patients. By definition, the medical ethics is a branch of ethics that deals with moral principles and values in the context of healthcare and medical practices. It involves making ethical decisions and resolving dilemmas that arise in medical settings. It is a vital aspect of healthcare that deals with moral principles and values guiding medical professionals' conduct. Let's talk about the pillars of medical ethics, also known as principles of medical ethics. The four principles of medical ethics are autonomy, means giving the patient the freedom to choose freely where they are able. In other words, respecting patients' right to make informed decisions about their own health care. This is the first pillar. Every patient should be given autonomy over their choices, how they can choose between different treatment regimes, how they can proceed with a particular interventional procedure or an investigation. The second pillar is beneficence. In simple words, doing good, acting in the best interest of the patient and promoting their well-being. This is the second pillar. You give the patient autonomy, you deal them in a good way, and non-maleficence, that is to do no harm, avoiding harm to the patient and minimizing risks in your treatment strategy. The final and the fourth pillar is justice, ensuring fairness, that is fair distribution of healthcare resources and equal access to medical care irrespective of the patient's background, the patient's religious affiliation or whatever. You have to treat every patient with justice. These four principles represents a framework for analyzing the best action to take in a given situation. To use this approach, you must consider whether your actions are in compliance with each of the four pillars. Here is an example of ethical dilemma. Suppose a patient has appendicitis and the surgeon believes that surgery is necessary. Technically, making an incision into the patient's skin is causing harm to the patient. However, this is done with good intent, as removing the inflamed appendix eliminates the risk of progression to rupture and peritonitis. Surgery would be offered to the patient based on their clinical need, and they will have the right to make an informed decision. The four principles would therefore support performing this surgery. This was an example to give you an idea of how you can implement the four pillars of medical ethics. The role of informed consent in these patients. Informed consent is the process of providing patients with adequate information about their medical treatment or participation in research, allowing them to make informed decisions. Informed consent is basically an informed decision, and this is a process by which you provide the patient with adequate information about what their treatment is, or if they are being included in a research study. Patient should know what is happening to him or her, right? It is essential to respect a patient's autonomy and give them the right to refuse or accept medical procedures or treatments. You have informed a patient about a particular treatment. You have informed the patient about a medical procedure or medical treatment, Now, the patient should be given an autonomy or the right to refuse or accept that treatment protocol or that surgical or invasive procedure. During your medical practice, important ethical issues that can arise are outlined here. The first one is informed consent, ensuring patients have sufficient information to make decisions about their treatment. The second principle is confidentiality, that is protecting the patient's privacy and maintaining the confidentiality of their medical information. It's a top secret. End-of-life care is another ethical issue, and addressing issues related to euthanasia, assisted suicide, and the withdrawal of life support. In certain rare circumstances, this can be a challenging decision to make. Resource allocation is that making difficult decisions when resources are limited, such as organ transplantation. These are the important ethical issues that can arise in a day-to-day practice depending upon where you are practicing. Informed consent and confidentiality is something that you can practice everywhere. However, end-of-life care and the resource allocation should be very cautiously proceeded with. In particular, resource allocation should not be limited to organ transplantation, but also to the availability of the in-hospital resources in resource-poor countries. There, the hospitals are overburdened and you have to choose between patients whether to admit them for inpatient care or send them on home treatment in a manner that the patient's outcome is not at the stake. There are many ethical dilemmas in medical research. For that purpose, informed consent is very important. And the purpose of informed consent is that the participants are fully aware and they fully understand the risks and benefits of research studies. In case of animal testing, balancing the potential benefits of medical research with the ethical concerns of animal welfare should also be kept in mind. Genetic research has stepped up in the 21st century. Many ethical issues are related to genetic research, and the ethical implication of genetic testing, cloning, and gene editing should be kept in mind, should be persuaded. Not only the governing bodies but also the regulatory bodies should keep an eye on these research projects. Some ethical dilemmas may arise at the time of research publication and authorship. In this scenario, you should ensure that the proper credit and recognition for researchers should be there. Every researcher who was involved in the study or in the research project, credit should be given to them and their efforts should be recognized. With the advancement in medical science and the emergence of new healthcare technologies, ethical challenges in global healthcare may emerge as a result. And the most important is the discrepancy and the lack of access to healthcare. Disparities in healthcare access and resource allocation between different regions and populations should be sorted out. Medical tourism is a new concept. Ensure a balance of medical tourism with concerns about exploitation and quality of care. An example of medical tourism would be, say for example, a person requires stenting of his coronary arteries and he is given a date of 1 year from now onwards. He chose a different country where he can proceed with his procedure quickly. He visits that country, performs his procedure. Now this should also be balanced, that this particular patient receives the care but not at the cost of affecting the already awaiting patients in that particular region. Humanitarian aid is an important thing. It means that ensuring ethical standards are maintained in providing medical assistance during crises and disasters. This is another important aspect, so that deserving populations and group of people should receive adequate medical assistance during the crisis and disaster periods. Cultural sensitivity is that respecting cultural values and beliefs while delivering healthcare services to diverse populations. So if you are working in a place, in a healthcare setup, where you have to interact with people from different cultural backgrounds, from different religious backgrounds, from different geographical background. You have to be well aware of their cultural, religious beliefs, and should tailor your treatment plan, your intended investigations that suits their cultural and religious beliefs. Respect should be given to every human being as a whole. In conclusion, medical ethics is crucial for maintaining trust and integrity in healthcare. It guides healthcare professionals in making ethical decisions and navigating complex moral dilemmas. By upholding ethical principles, we can ensure the best possible care for patients and promote the well-being of individuals and society. Thank you so much. If you have any questions, please post them in the comment section. And if you are new to my channel, please subscribe, press the bell icon for future videos. Thank you so much.